Men who stop having sex are twice as likely to develop erectile dysfunction. That is not a theory. That comes from a landmark study tracking over 1,000 men for 5 years, published in the American Journal of Medicine, and most men have never heard it, because the assumption most men carry is the opposite, that rest is neutral, that the body simply waits, that nothing changes during periods of inactivity. The research tells a very different story. Your penis is not passive during inactivity. It is changing. And after 50, those changes happen faster than most men realize. Hello, gentlemen. I'm Dr. Reena, urologist and men's health advisor. Today, I am going to show you exactly what happens to penile tissue, testosterone, and erectile function when sexual activity stops, and what the research says about how much of it is reversible. Drop a 1 in the comments right now if you have ever noticed a change in erection quality after a period of lower sexual activity. Just a 1. I want to know how many of you this is actually affecting, and if this is the kind of content that gives you real clinical answers instead of generic advice, hit that like button and subscribe. This is exactly what this channel is built for every single week. Now, before the science, let's understand where the assumption comes from, because most men do not arrive at sexual inactivity thinking it is a problem. They arrive at it through life, a difficult period in a relationship, a partner's illness or absence, stress, depression, a demanding job, or sometimes a deliberate choice based on the belief that abstinence preserves energy or focus. And in all of these cases, the assumption is the same. The body is simply waiting. Nothing is being lost. When activity resumes, everything will return to normal. That assumption is understandable. It is also clinically incorrect. The penis is not a passive organ during inactivity. It is a vascular organ that requires regular blood flow to maintain its tissue health. Without that blood flow, changes begin slowly at first, then more significantly over time. And after 50, when natural vascular aging is already reducing nocturnal erection quality, the pace of those changes accelerates. This is not meant to alarm you. It is meant to give you the information most men are never given, because understanding what is happening is the first step to doing something about it. Now let's go through what is actually happening and what the evidence shows at each level. What happens to the tissue in the flaccid state? Penile tissue oxygen levels sit between 25 and 40 millim of mercury. During a full erection, that level rises to 90 to 100 millim of mercury. That surge of oxygenated blood is not just what creates the erection, it is what keeps the tissue inside the penis healthy. Without regular erections, oxygen levels in the tissue stay chronically low. In 1998, researcher R.B. Moreland proposed the hypoxemia hypothesis. Low oxygen in penile tissue triggers smooth muscle cell death. Those cells are replaced by collagen, a stiffer scar-like tissue called fibrosis. Fibrosis reduces the tissue's ability to expand during arousal, which means erections become harder to achieve and harder to maintain. This is the biological mechanism behind the phrase, use it or lose it. It is not a metaphor, it is a documented physiological process. What happens during sleep? Now, healthy men experience 3 to 5 erections during sleep every night. These are called nocturnal penile tombs episodes. They occur during REM sleep and provide approximately 2 hours of oxygenation per night. This is the body's natural maintenance system for penile tissue. It happens automatically whether or not sexual activity is occurring. But here is the clinical reality after 50. Nocturnal erection quality and frequency naturally decline with age. Vascular health decreases. Testosterone drops gradually. Sleep architecture changes. All of these reduce the quality of the body's nightly maintenance window, which means after 50, nocturnal erections alone are often not sufficient to fully protect penile tissue health. Daytime erections from sex or masturbation provide additional oxygenation that the body increasingly needs. Remove those as well, and the tissue has significantly less protection than it did at 35. What happens to testosterone? Now, the testosterone finding from this research is one of the most underreported in male sexual health. A 1999 study by Giannini and colleagues measured testosterone in men with erectile dysfunction and sexual inactivity. Total testosterone was 37% lower in inactive men compared to sexually active controls. Free testosterone was 29% lower. And here is the finding that matters most. When sexual activity successfully resumed, testosterone levels rose significantly. The relationship runs in both directions. Lower testosterone reduces sexual drive and erection quality. Reduced sexual activity lowers testosterone further. That is a self-reinforcing downward cycle. And resuming activity, even gradually, can begin to reverse it. I had a patient, I will call him James. James was 42. A high-stress job had effectively ended his sex life for over a year. He came to me having lost morning erections and developed mild erectile difficulty. Blood work showed significantly lower testosterone. He assumed it was permanent aging. After lifestyle changes and gradually resuming sexual activity, both testosterone and erection quality improved within months. He told me, "I thought my body had just changed with age. Turns out the lack of use was the bigger issue." Drop your age in the comments right now. Just your age. I want to know exactly who is watching this, because what I am about to cover next is specifically important for men over 50. And your age helps me understand what content to prioritize for this community. Now, the physical changes from inactivity are only part of the picture. There is a psychological layer that compounds everything, and most men never see it coming. When a man returns to sexual activity after a long break, the first attempt is often difficult. The erection is weaker than he remembers. Performance is not what it was, and immediately his brain interprets this as permanent damage. That interpretation triggers performance anxiety. Performance anxiety activates the sympathetic nervous system, the fight-or-flight response. That response constricts blood vessels and suppresses erection quality, which confirms the fear, which increases the anxiety, which makes the next attempt worse. That is a cycle, not a diagnosis. I had a patient, I will call him Richard. Richard was 55, divorced, 3 years without partnered sex. He had maintained occasional masturbation throughout, so his tissue health was relatively preserved. But when he began dating again, performance anxiety overwhelmed him completely. He came to me convinced something was permanently wrong. A clinical examination showed no significant fibrosis. The issue was the anxiety cycle, not the tissue. With reassurance, consistent activity, and short-term support, the cycle broke within weeks. He told me it felt like permanent damage. It was a temporary loop. Understanding the difference between a physiological change and a psychological cycle is one of the most important things I can give you today. They feel identical from the inside. They are not. Now, I want to give you the honest clinical picture on reversibility, because this is the question every man watching this actually needs answered. What is reversible? The testosterone drop from inactivity is reversible when activity resumes. The Giannini study confirmed this directly. Testosterone rose significantly when sexual activity returned. Early-stage smooth muscle changes are reversible with resumed erections, whether from sex, masturbation, or medical support. Performance anxiety cycles break with reassurance, consistent activity, and in some cases, short-term clinical support. Post-surgical rehabilitation studies show 52 to 67% of men regain meaningful function when they commit to rehabilitation protocols. The key word in all of this is early. The earlier the changes are identified and addressed, the more completely they reverse. A few months of inactivity is very different from several years. And even after years, meaningful improvement is possible for most men with the right approach. Now, advanced fibrosis from years of complete inactivity is harder to fully reverse. The collagen that replaces smooth muscle does not simply disappear when activity resumes. In those cases, medical support is often necessary. Medications that promote erections, vacuum devices that mechanically oxygenate the tissue. In some cases, more targeted interventions, but even then, significant improvement is achievable for most men. The message is not panic if you have been inactive. The message is do not wait longer than you already have. The body responds to being used. It always has. Now let me give you what the evidence actually supports clearly and without hedging. The research consistently shows that once weekly sexual activity or more provides measurable protection against erectile dysfunction. The Tamper study found that men having sex less than once per week had twice the 5-year ED incidence of men having sex weekly. Men having sex 3 or more times per week showed an 85% lower risk compared to near abstinent men. Now, frequency matters, but so does what counts as frequency. Masturbation produces erections. Erections deliver oxygen. Oxygen maintains tissue health. A urologist reviewing this evidence does not distinguish between partnered sex and masturbation when it comes to penile tissue maintenance. Both count, both protect during periods when partnered sex is not available. Maintaining regular erections through masturbation is a clinically valid protective measure. This is not widely said. It should be. Now, if you are experiencing changes in erection quality right now, do not self-diagnose and do not wait. See a urologist. A simple examination and blood work can tell you exactly what is happening and exactly what to do about it. Most of what you are experiencing is addressable, but only if you give someone the chance to look at it. The research is not ambiguous on this. Regular sexual activity, partnered or solo, protects penile tissue, maintains testosterone, and significantly reduces your risk of erectile dysfunction. Your body works better when you use it. That is the finding. And now you have it. If you are in a period of low sexual activity right now, this is not a death sentence. It is information. And information is what you act on. If this gave you something real today, subscribe. New content every single week. Evidence-based, honest, and direct. Designed to make you a more informed, more confident man when it comes to your health. I do not want you to miss it. Your health is worth investing in. Understanding what is actually happening in your body gives you the power to do something about it. Thanks for watching. Keep learning, keep growing, and keep taking care of yourself.